To hit the back of the leg, there's a few different things we need to do. First thing is, like, if you imagine the belly of your low leg, it's got two bellies in the gastroc anyway. So one on the inside, one on the outside. And quite often what happens is those get stuck together. There's a bit of connective tissue in between them. And so the first step is to break those two bellies apart. To do that, what you do is you take a ball on the block and then pop it in. You need to find like where the more tender parts are. Usually there's a fairly built up area sort of at the base of the belly of the muscle. So I'll start there and find that little sweet spot. Take a lay down, make myself nice and comfortable. I like to prop myself up. Then we're going to take the other leg and drop it on top just to add a little bit of extra pressure. Let that sink in with a couple of breaths. And then we're just going to get a small, I like to start with small circles in the foot, so in the foot that's on the ball. So the circling action kind of gets the bellies moving, the bellies of the calf moving slightly differently, and creates shear in between them with a little bit of pressure from the ball. And there comes a point where you find a real tender bit. So I like to sink in, just another couple of breaths. And then go slightly bigger with the circles. And once that tender point starts to sort of be less tender, then just move around, find the next bit. Now I've moved over onto more of the lateral part of the calf. So I'm sitting on the belly, but the way I'm doing it is kind of pulling my leg down off one side of the ball. So I'm essentially trying to pull that belly away from the center and from the medial side of the calf. So I'm separating the tissue like that. And the ball is just pushing the tissue of that lateral belly more sideways. Take a couple of breaths just to let that soften. And you'll feel it starting to open up just a little bit. Might take a minute or two. If it takes more than that, then it's probably not going to release. Not this time anyway. Might take a few sessions to open it up. So you can continue that one until you feel the release. Next bit is, you can work obviously all the way down the calf and into the Achilles that way. The next one that I like to do is to take the tissue. What I find the next kind of most prominent area that they get stuck is in between the deeper muscles of the calf and the bone. So we're going to go into sideways movement. So bring yourself up onto, I like to use a box like this. So this one's, what is it, roughly a foot tall. So I'm going to bring myself up onto the box and just find that little tender point that's in right behind the bone here in the soft tissue, and then drop some weight into there. Don't need to add the extra leg. If this one's stuck, then it's going to be pretty tender as is. So just let that sink in again with a couple of breaths. And then with that foot sort of drooping down like that, just move the foot up and down. Start to get a little bit of that movement. feels pretty open. You can start to go into bigger circles, but I find there's too much tension. It just sort of kicks you out of the of that spot where you're working on. So I don't like to go all the way around with the circle. You can see my leg just rolling all over the place. So keep it fairly low. Gradually working into bigger sweeps with the foot back and forth. And then once you've got some release there, then move to the next spot. I find for me, again, it's this area in the middle of the calf that is the most tender and needs the most work. So you can work all the way from there through there. If you do find some more up there, higher up on the calf, then work them too, but it's less common to get the adhesions through there. The next part is to work the outside of the calf. So I don't need that box anymore. Or the foam block. And this one, you can just sink in, assuming your mobility in your hips is okay, and just let the ball work its way along the outside, so underneath the bone, so this side of the bone, the soft tissue side of the bone. You're not on the bone so much. I mean, you can get some release with those perineal muscles, but you're really about peeling off as much as you can. So I like to put pressure on there, and then using my hand, shuffle back so you can see, and then using my hands, I kind of just jostle the tissue on this side. So it's more of a slow, like I say jostle, it's more like a almost stretching, so you go to that point of the first resistance and just let it sink in. Take a couple of breaths, and the amount of tension is not, you don't want to be ripping the muscle all the way off. It's just that first point of resistance. Take the breath, a couple of breaths. When the tenderness lessens, then move on to the next spot. Same sort of deal. It's kind of like you're pulling. So the muscle we worked on the front of the shin, you're going to try and pull that away from the perineals and the muscles at the back of the calf. You can also add in a little bit of movement with the foot, just to aid a little bit more of that shearing kind of effect. And then work your way all the way down, right down to the ankle bone. You still feel, it's often pretty common anyway to get tight through that bit right there as well. So wherever you need it. Could be anywhere from the fibular head right up in the near the knee, so you work just underneath that to just above the ankle. Obviously you want to work for the other side as well.